have the pleasure to welcome you to this event, and to this, I would like to take and welcome our distinguished panel. I would like to thank each of you who are here in person for coming. I would like to take and welcome those of you joining us online. I think this is going to be a wonderful and interesting panel discussion that we're going to have. I want to thank particularly Dr. Joan Bonifar, who has taken the lead in as the head of the Institute and putting this program on. I'm Edward Taylor, the director of the School of Social Work that has had the privilege of co-sponsoring this. We look forward to having a lively discussion and learning a great deal today. So thank you for being here, and we look forward to comments and your evaluation after the program. Thank you.
Well, hello. It's my pleasure to add my welcome to Ed's. And I'm Carolyn Gauthier. I'm a professor at UBC, the other UBC, the one in Vancouver. And I'm in the School of Population Public Health. And I've been really quite privileged to be able to work with Joan and some of the other fine faculty here at UBCO, and looking forward to the future. I think this afternoon gives us a great springboard for discussion and learning a lot about some very exciting programs that are happening all over the world, in fact. And we're very privileged to have a distinguished set of speakers this afternoon to share their wisdom with us. So we'll be having 3 sets of presentations. I'll introduce the people who will be speaking in each one of those sets. First thing, they'll come up and give their talk, and then you'll have a chance to have your questions, whether you're listening to us by telephone, in which case you should unmute your line before you ask your question. Online, you can actually type your question in, and we'll be reading them. And then in person, we'll have you step up to the microphone and ask your questions. So we're greatly looking forward to the afternoon, and I want to start out by introducing the first 2 speakers. And they'll be talking about a really interesting program based in Australia called the ManUp Project, Improving Men's Physical Activity and Nutrition. And the speakers are Dr. Mitch Duncan, who's a research fellow, Institute for Health and Social Science Research at the Central Queensland University, Rockhampton, Queensland, Australia, and Dr. Christina Capriccioni, who's an assistant professor here at the UBC Okanagan campus in Human Kinetics, the School of Health and Exercise Sciences, Faculty of Health and Social Development. So please come forward and share your experience with us.
Good afternoon, thanks for coming along today. I'll be talking to you a little bit about the ManUp project, talking through some of the outcomes that we've had from the project, before handing over to Christina to talk about how some of the methods we tried to get to, promote the intervention to the wider community, and hopefully that'll make a little more sense as we go through it. It's obviously a big team here that we were working with, and obviously very grateful to our funders, Queensland Health, for helping us out with this one. We paired up with a number of different universities and research institutes in Australia. Due to time, I won't go too much into that, and I do apologise if it is a bit rushed. We started the program in a little regional town called Gladstone in Australia. We paired up with a number of industry-based partners to help us with disseminating and our message at the end of the project, but also helping to recruit participants during the evaluation part of it as well. So in terms of why men and why we actually cared to do this project, basically they're an inactive population whose dietary habits aren't great. In Queensland, Australia and around the world, we've got a fairly high proportion of the population who's overweight and obese. Life expectancy isn't great for these guys compared with women. And you can see here one of our posters that we use to recruit participants, where that central, fat mass is quite common in and around where we were doing this. And we tried to tap into that people should be doing something about that to help with getting on board with the project. And this project was set up in the context of the release of the National Male Health Policy in Australia. And really this was around trying to get men to take a bit of ownership for their health and engage in some preventative behaviours. Some of the key ones, of course, are physical activity and healthy eating as well. And we did try throughout, even with the naming of our project, is to try and engage men with their health and to take ownership of that. Briefly, our funding body put together a call to piece together a project that was IT-based, that targeted men's physical activity and healthy eating, and we were tasked with targeting 35 to 54-year-olds, so middle-aged men, because they were seen as a bit more of an at-risk group. And we set the project up in terms of 4 phases. So today I'm really going to rush through phase 1 and 2, which was basically just reviewing the literature to find out what's there and what works for men, developing our intervention. I'll be talking about the actual evaluation of that, and then Christina will be talking about the dissemination of that. So here's Gladstone, little town, I guess in central Queensland, Australia, and you can see there the bottom picture, very industry-based town. Lots of industry happening there prior to our project commencing, and then there was a real burst of industry taking off with coal plant expansions during our project, and also drilling for liquefied gas as well. Some basic demographics about the Gladstone community. Whilst it's around 50,000 people when we started off the project, there's only about 8,500 in our target group. So immediately we were kind of behind the 8 ball with trying to recruit people into the project, because that's quite a small number for a population that's renowned for not really engaging with preventative health behaviours. So basically, when we did our literature review, we found that there wasn't a whole lot there out in the existing literature. And when we were looking at the delivery modes, IT seemed to work, face-to-face seemed to work. There wasn't any real standout delivery mode for these interventions. But what we found was useful for these people was self-monitoring and peer comparison, so being able to compare with each other, some social support, and also tailored feedback, and also choosing the behaviour, so what they wanted to do. So we then took through, and this was our general idea for the project, is that we'd have a website portal that men could log on to, get information, self-monitor, and also, because we wanted to be taking advantage of the smartphone technology that's existing, we thought that we'd give them the opportunity to access the intervention materials on their phone. That was kind of circumvented very early on, because when we talked to the men, they said we don't want to read large volumes of text on our phone. We talk and make and send the occasional text message on our phone. So we had to revisit our strategy very early on the piece there. Also, the other thing that went against us in terms of smartphones is that most of these guys owned the older Nokia brand phones, so it wasn't touchscreen. You were kind of having to scroll through menus using kind of very clunky interfaces. There was also a large variation in the brands that they owned, so it made going down one specific platform very difficult for us. And in fact, we didn't go that way. We went with a mobile accessible website. And you can see again, the men just want to use their phone to make calls and send the occasional text. And nothing else was really happening there with their phones. We also talked to them about, okay, well, how do you want these messages delivered? They said, we want it clear. We want very directive messages in terms of what we're meant to be doing. They knew the basics that they should be getting out there and being active, but they didn't really know how or what they should be doing. We asked them about their IT usage, and they were fairly comfortable with using computers and the internet and that, but they didn't really know that they were using what we'd call Web 2.0 technology. So they'd say, yeah, I'll watch the occasional video, but they thought that's just what you did. There wasn't anything, they didn't see that as anything too novel. Small proportion said that, yeah, okay, I'll use my mobile phone to log my behaviour, but I'm not going to spend a lot of time doing that. I want it to be very clean and very simple to use. And that's what they also asked about the website. Very clean interface, and you'll see our website, very stripped back, website compared with some of the websites around at the moment. So that's just there, what I went through. So in terms of our design and how we tested this, we had a two-arm intervention. So we had a print-based booklet group and an IT-based intervention. We thought that we were going to find it pretty tough to recruit men, so we made a targeted strategy to use a 2-to-1 recruitment. So we placed twice as many men in the IT group as in the print group, because in our review of literature, men were very underrepresented in IT-based interventions. It was 9 months long, and you had access to the intervention throughout that period. We didn't withdraw the intervention at all, and we had assessment periods at 0, 3 and 9 months. Education was very clean and very simple. It was quite stripped back. We've really focused it in on why. So that was health, economic and social reasons for healthy eating and activity, how you can do that and where, so information on the local community. Self-monitoring was a major component. Goal setting, I'll talk a bit about that more. And the main differences between the two platforms, or the print versus the IT, was the feedback and the social support that people could have. The website offered greater flexibility to deliver instantaneous feedback to people, whereas obviously with a pen and paper, it's a little more of a manual process. And social support, you could interact if you chose online. So we had 317 males come into the study. It took us a very long time and quite painstaking to get those 317 into the study. We basically, as long as you were fit and able to move, didn't have any chronic health conditions and had access to the internet, you were in the trial. We looked at change in physical activity, dietary habits, and self-reported BMI. We also looked at physical activity and nutritional literacy, and we also took some objective measures of physical activity status and body weights as well. The main component of the intervention in terms of how we were trying to change behaviour was based around challenges. So we asked men to do both physical activity and healthy eating challenges. And for each of those, you had 3 strength challenges. So you had a light strength, mid strength and full strength. Corresponds with the beer strengths in Australia in terms of alcohol content. And they varied in terms of duration and the volume of activity that you were required to do. There's no particular order to how they're presented there, but you can see you could choose from a number of different activities. And with healthy eating, it was about, men didn't want fancy recipes. They just wanted some basic activities that they could be doing. And so we came up with a list of 10 healthy eating goals that you could choose from on a day. And that was things like going red meat free, alcohol free day, getting 2 serves of fruit, 5 serves of veg, soft drink free, very basic, easy things to do. And obviously the different strength challenges varied in how many you had to accumulate each day. Here's our website, front page, very clean, very basic. This was the main section of it when you logged in, and so this is really the self-monitoring hub of the website. So you can see here a graph of my progress over time, so you could see how you were going in comparison to your challenge. You could have, if I can get the mouse to work, you had mates on the left-hand side there, where you could search out for a friend online and interact with them, see their profile. You could schedule reminders for activity for yourself, so you could get an email or text reminder. And we really tried to make it as useful for the men as possible, whilst also being very clean and very simple. Here's our ManUp Mobile. So you can see here, again, very much focused on just checking boxes, simple, clean, easy to use, with some feedback there for the men in terms of how they're progressing with their challenges. I won't go through that, but basically we had a lot of trouble getting men back in for their 3-month appointments. It took a lot of work by our project staff to get them in and keep them engaged, coming back for those appointments and completing their online surveys. In terms of who we got in, middle-aged, we were after blue-collar workers, but we ended up with a fairly white-collar professional mix of things. Here we see change in behaviours. I won't spend too much time on this, but really what we saw was that we were able to increase the minutes of physical activity that men reported doing at both 3 and 9 months. They reported that they increased the number of sessions that they were doing of physical activity and also increased their serves of fruit and vegetable consumption. So that's good. It seemed like we made a change. Self-report data has its limitations, but we make do with that. Physical activity literacy, we saw a change. No change in nutritional literacy. We think that was because of how we measured that. Interesting, when you look here at measured minutes of activity using the accelerometer, we saw no change. And when we went back and looked at the data, it was quite obvious that the group that we randomly selected to do this objective measurement didn't change their activity, whereas the people who weren't selected for that did change their activity quite a bit. So that's the downside of having, I guess, people come in to do the measurement. You may have some unintended consequences there. And we didn't see any change in self-reported BMI. It wasn't a weight loss intervention, so it's not surprising that we didn't see a change there. In terms of IT usage, it was pretty low. We saw that it did, people dropped off. They came in, had a look around, and then really trailed off after that. And we think that could be because of some of the challenges that people were doing. So predominantly they did a light strength challenge, which was 3 weeks. And you can see usage really drops off after that. So if we can get people coming back onto the platform, we might see them hanging around longer if they do repeated challenges. So I won't spend too much time on this, but I will hand over to Christina in terms of how we got the message out there after that.
Okay, so I will try to be quick because Mitch, as per usual, likes to steal my thunder. So this might be very interesting to some of you, especially with regards to grant funding and stuff, because we all know that everyone's interested in knowledge translation. So we have a little bit of knowledge translation here. I can't promise you it's actually positive results, but it gives you an indication of how difficult really it is to translate research into practice. So with our final steps, we did the randomized control trial, but then we thought, okay, we're going to open this up. We really need to get this out to the real world because these are the people that are going to be using it. So we, at that point, opened up the entire website and the ManUp project to anyone, any gender, any age. They can go on, anyone that was interested to it. And with that, we chose a number of dissemination activities to try to really get what we found out there. The 4 main ones that we want to talk about today is just social marketing, individual counseling with health professionals, the use of traditional and non-traditional providers, as well as workplaces. And I will quickly go through what we use as an evaluation framework to look at the dissemination and translation, which is the REAIM framework, where we looked at the reach of the project, adoption, effectiveness, implementation, and maintenance of strategies. So just to give you a kind of an indication of what we did with these dissemination activities, so with regards to the social marketing, we had a prolonged media campaign, both radio and print-based. The print occurred over 2 phases. Every week, for 13 weeks, we had an article written based around the A to Z of healthy eating or healthy lifestyles. So each week, we'd start off with the first week being A and B. So for example, A might be an article about active living or active something, and B might be burning belly fat. So it had to do with physical activity or eating or healthy lifestyles, and that carried on over a 13-week period, going through the letters of the alphabet. As well, we had awareness-raising advertisements in the local newspapers. We did use 2 different newspapers, one that was a free newspaper throughout the region, as well as the paid newspaper. And again, these were advertisements about promoting healthy eating, healthy lifestyles, as well as nicely trying to encourage them to go see the ManUp website and to get involved. So we were trying to push them towards that way. The radio campaign was very similar to some of the print media messages, just looked at health behavior change, And again, nicely dropping the line of, oh, if you want to find out more, please see the ManUp website at www.manup.org. One of our second activities was individual counseling, and we really saw it important to get the credibility of our health professionals throughout the region involved. We looked at general practitioners as well as allied health professionals throughout the region. When we look back on this, we were wondering, this is a great opportunity, but we noticed not a lot of men go to see their doctors, unfortunately, but this was a good way to get them starting to think that way. So with this, we developed these provisions of these information packs, and we had them for the GPs or in their practice or their surgeries. And then we also had information packs for health providers. We also had posters and leaflets that we would leave in their offices that if people were there, sitting, waiting for an appointment, they could just take and read and grab and carry on. Working with traditional, non-traditional providers, some of these were really positive. We try to hit areas where men, or at first, would be involved, but then opening this up as a dissemination trial over all genders and ages, we really try to get everyone involved as well. We looked at partnering with a golf day, so we wanted to make it an active golf day, so we sponsored a hole, and we had some individuals wear pedometers and try to get them involved and thinking about their activity while they were out golfing and drinking beer, of course, but we were trying to get them to think about just being active, and they could do that simply by walking on the golf course. We also had an idea to fishing charter. Okay, Mitch, you stole all my time. Fishing charter, we looked at a community stall where we had someone providing information at a community place, different community events, and the promotion in non-traditional areas, organizations, sporting events, that sort of thing. Okay, I'm going to try to get through this quickly, but all in all, with the workplace guide we developed, and it went into the workplaces, and these workplaces had the ability to look at this guide, and it'll explain to them why they needed to promote physical activity, healthy eating, how they could plan on implementing it, and how they could potentially implement it and evaluate it. So the important part, how we look at this. So the reach, these were our results. We measured this via the computer-assisted telephone interview survey, and we ended up getting about 312 individuals. Overall awareness was about 46%, which is actually quite comparable to a lot of large social media campaigns, and we found no differences in those variables there. Effectiveness, this was based on pretty much what Mitch said, so it was effective for us from our main objective, and that was to be successful in increasing weekly minutes of activity as well as increasing the consumption of fruit and veg. Adoption, we looked at measuring via the registrations for the trial. So this was actually quite low, but this was real world stuff. Like, we didn't try to recruit people. This was, here's something, how many people can we get? We only got 73 participants that actually registered for the trial. About 80% of them were males. The other 20% were females. Potential reasons for this, we did try to follow up using the CADI survey, and there's a number of different reasons that I can talk to you about later on. At the organizational level, so that was the individual level, we did have a number of organizations or workplaces that took it up and implemented it. Almost there. Implementation was measured at the organizational level with a subsample of the organizations that were interested in ManUp or being involved. Of the organizations that we did talk to, a quarter of them actually implemented it on a general basis. They provided a lot of the resources and the program in general to their workplaces, which was great. 5 of them are currently still considering taking that up and getting it out to their employees. 2 of the workplaces stated that there was just too much red tape that they had to go through to actually implement something like that at their workplace. And one of the organizations said it was just too hard, that we didn't have the resources to actually implement it in our workplace. And lastly, maintenance, which is an important aspect. This was measured by our website usage at this point, because that's all we really had to look at, was this being maintained. So as you can see, compared to the randomized control trial, I gave a couple examples. So with regards to like the average log-on, per week for the real world trial, it was 0.17 times a week, compared to 0.53 times for the randomized control at 3 months and 0.24 at 9 months. So there was a real difference there of really getting that out there. And that was the same with actual entries. We saw a difference where it was 0.42 times a week for the real world trial versus 1.29 and 0.59. And again, as mentioned, a quarter of those organizations did actually implement the program and disseminate it on a general basis. So just in summary of the overall project, what we kind of learned and some of our recommendations for future studies, we did learn quite a lot. We still need to understand how to engage men. We thought we could do something, but it's difficult. We need to really have those clear behavior change messages, nothing fancy, nothing sexy, just give it to them and have them run with it. A mix of mass media messages. They really liked all the different ones. Their awareness was quite high, so the radio, the print, website, all that sort of thing. A website portal that allows materials to be printed. A lot of them, and remember this age group is middle-aged men, but a lot of them wanted to be able to print stuff off so they could actually hold it in their hands, so they had hard copies. And just, they wanted to see more local information. It's quite difficult when you're trying to get this out to the real world, to provide, you know, in your area, there's this access to these facilities, and in your area, there's great fruit and produce markets. You should go see them. So it's kind of hard to pinpoint because all these people are coming from all over the place. And so that's it.
This comes from Wayne Hardrick, and he said, "What was the total cost?"
Tough question, Wayne. Over the 3 years of the project, we received $800,000. So when you're looking at, in terms of the amount of people we'd reach, particularly in the dissemination, definitely not ideal. A lot of that time was spent, really the first 18 months was spent developing the online environment for them, and quite costly and time intensive to do that, as well as following them up. So that's where all our costs went.
And not to mention, on top of that 800, there was a lot of in-kind support that we were able to get. So if we were to look at all of that, it would have been a lot of money for what we actually got at the end.
Okay, we have another interesting question for you guys. This one comes from Margaret Zanchetta, and she asks, "Can you please explain what is red tape and why some organizations said that there was too much of it?"
Okay, red tape, in terms of, I guess, administrative barriers in the workplace. So it could be existing human resource policies, health and safety requirements to comply with certain things in your organisation that just made it too difficult to actually come in and implement something as basic as, hey, you should do more activity and eat a bit better within the workplace.
The 800,000, where did you get the 800,000 from? That's the first question. And the second one was, what kind of organizations were you dealing with, you know, both by way of size and by way of nature? Was it all public service? Was it all unionized factories? Was it all, yeah, et cetera, et cetera? So the two questions.
Yep.
Where did the money come from, and who were what were the organizations?
So our funding body was the state government health department,
Which government?
the Queensland government. So, yep.
Queensland.
Queensland, Australia. Yep. And the types of organisations that we were engaging with, trying to recruit people and get the word out there, was really we targeted the local businesses. So that, you know, the major ones in town are the power plant, there's an aluminum treatment plant, the Ports Authority. We had some buy-in from Queensland Rail as well. So we really did spend our time trying to focus in on these larger organisations to maximise any potential penetration we could get.
And that's not to say we ignored the smaller ones, because we did go to a lot of the smaller local organizations to get men, the local leagues, clubs, and other areas where men would hang out, I guess. But we did, as Mitch said, focus there because we were trying to get larger numbers and to get things going. But we went across pretty much all organizations that would listen to us in the region. And that was one of our strategies right there, was just trying to get them on board.
So what what were they complaining about? They're used to dealing with it. You may not have the answer to this and so forth, but is it a case of they weren't that enthused? Were they just playing lip service to you, your program?
Yeah.
Or was it something that was inherent in your program that really tripped them up?
Yeah, we didn't really follow that up in terms of what precisely was the red tape. We designed the program to be pretty much as flexible as possible. Jump on the website and away you go. So yeah, I mean, they could have just been saying nice things to us, and it was too much red tape. We don't know.
To add to that, though, what we did get to was our project officer, Marcus, who was on the floor there, one of his biggest complaints was actually being able to contact people. He would send emails, he would call, but he would never get a return. He would go there to try to see people, and, if he finally got in touch with them, we're just too busy, we can't meet with you, it's not a priority.
Yeah, even access to some of these sites had to, arrange, weeks and weeks in advance just to get on to speak to the HR manager.